I am a harm reduction lead navigator. I struggled with addiction back when I was a little bit younger. I also was homeless at one point. We didn't have the help that I see that we have to offer our clients nowadays, especially as well with the harm reduction supplies. Harm reduction doesn't just give out the supplies, we also help individuals that are ready to take that next step to move forward. We have those resources for them, and a lot of that was not was not available from what I understood back then.
Harm reduction is a suite of evidence-based services that really are intended to reach people where they are. Things like offering syringe exchange, naloxone, which is an opioid overdose prevention medication, fentanyl and xylazine test strips. They're ways for us to engage people who may not be ready or interested in something like substance use treatment. That engagement piece is really the key for us to build relationships in order to try to get more people into needed services. And harm reduction is one of the best ways for us to do that.
Me being homeless, I need help, you know, and it's hard out here. I really want to go to a program, go to rehab, and get my life together. I really want to get off the drugs. I'm tired of, because me on drugs, I'm not focused. I can't, you know, take care of I can't I'm not in my right mind. I just want to get off drugs.
That amount of trust builds relationships that then lead to more meaningful engagement. And so when it comes to concerns about enabling drug use, harm reduction services don't provide drugs for anyone, right? They provide services for people who use drugs, and they provide sterile syringes so that people can use the drugs they're going to be using anyways in a way that doesn't jeopardize their health through transmitting infectious diseases and other conditions, and also increase the likelihood of overdose risk. And so, you know, without harm reduction services, there would be more overdose deaths, there would be more transmission of infectious conditions, there would be more both morbidity as well as mortality, particularly among vulnerable populations in our communities.
People do not just struggle with addiction because they choose to. People struggle with depression. People struggle with some type of mental health. We've been in their shoes. We know the situation. We know the feeling. I'm really glad that I'm making a difference. I'm really glad that they see me, that they have something to keep going forward.